Good morning, one and all. In the last lecture of deep structures in the neck, I have completed the thyroid gland. Today I am going to talk on deep structures in the neck and at the root of the neck. So, there are many structures in the neck and at the root of the neck. If we want to study, you have to study superficially to identify the landmarks. First of all, the sternocleidomastoid lies superficially at the root of the neck. So, if we reflect the sternocleidomastoid, we can see the following structures, that is carotid sheath with its content, that is common carotid artery, internal carotid artery, internal jugular vein and vagus nerve. The other structures, that is the phrenic nerve, subclavian vessels and its branches, the brachiocephalic vein, etc. Now we'll see exactly where the root of the neck lies. So in the diagram you can see the superior thoracic aperture. So the root of the neck is the junction between the thorax and the neck. The root of the neck is an important area because it lies superior to the thoracic aperture. All the structures that passes between the head and the thorax or the upper limb and the thorax must pass through the root of the neck. Now the image showing the root of the neck is the area immediately superior to the superior thoracic aperture and axillary inlets. Now we'll see the bony landmarks of the root of the neck. So in the image you can see the root of the neck is bounded by anteriorly the manubrium sterni and superior margin of the clavicle. Now posteriorly the top of the thoracic vertebra, that is T1, and the superior margin of the scapula to the coracoid process. Now in the image you can see the contents of the root of the neck. So the contents are as follows: sclenine muscle and prevertebral muscle, phrenic nerve superficial to the anterior scalene muscle, vagus nerve, root of the brachial plexus, subclavian vessels and lymphatics. Now scalene muscle, which is the content of the root of the neck. The muscles are anterior, middle and posterior scalene muscles. So the next content is the prevertebral muscle. So in the image you can see the prevertebral muscles. They are rectus capitis anterior, rectus capitis lateralis, longus capitis and longus colli. Now the vessels of the root of the neck. So I'll be giving much importance to the subclavian vessels. That is, first of all we'll see the subclavian arteries. So in the diagram you can see the right and the left subclavian arteries. The right subclavian artery arises from the brachiocephalic trunk posterior to the sternoclavicular joint. The left subclavian artery arises from the arch of aorta in the thorax. Now this left subclavian artery runs upward on the left mediastinal pleura and makes groove on the left lung and enters the neck by passing behind the left sternoclavicular joint. Now we'll see course and termination of the subclavian artery. So in the diagram you can see the subclavian artery, which I have marked with blue arrow. So in the neck on each side the subclavian artery arches laterally across the anterior surface of the cervical pleura on the first rib posterior to the scalenus anterior muscle. The termination of subclavian artery, it ends at the outer border of first rib. It ends by becoming axillary artery. Now we'll see the parts of subclavian artery. So in the diagram you can see the subclavian artery, it is divided into three parts by scalenus anterior muscle. For this you should know the origin and insertion of scalenus anterior muscle. So first part extends from origin to the medial border of scalenus anterior. The second part, it lies just behind the scalenus anterior muscle, and the third part extends from the lateral border of scalenus anterior to the outer border of the first rib. Now we'll see the relation of first part of subclavian artery. It is very important to know the relation of subclavian artery. So in the diagram you can see on the left side, that is the anterior relations, are common carotid artery, internal jugular vein, vagus nerve, vertebral vein, phrenic nerve, the muscles sternocleidomastoid, sternothyroid and sternohyoid muscle, the thoracic duct, cardiac branches of the vagus nerve and sympathetic trunk, ansa cervicalis, phrenic nerve only on left side. Now the posterior relation which I have marked with blue star, that is the apex of the lung covered by the cervical pleura and suprapleural membrane, the sympathetic trunk and right laryngeal nerve. Now we'll see the relations of second part of subclavian artery. So in the diagram you can see the scalenus anterior muscle which I have marked with blue arrow, phrenic nerve, sternocleidomastoid muscle. Posterior relations are apex of the lung covered by the cervical pleura and suprapleural membrane, the lower trunk of brachial plexus and scalenus medius muscle. Now we'll see the relations of third part of subclavian artery. So in the diagram you can see anteriorly you have suprascapular and transverse cervical vessels, subclavian and internal jugular vein. Posteriorly you have apex of the lung covered by the cervical pleura and suprapleural membrane and lower trunk of brachial plexus and scalenus medius. I hope you have understood the relations of subclavian artery, what lies anteriorly, what lies posteriorly to the subclavian artery. Now we'll study the branches of subclavian artery. Now in the diagram you can see from first part 3 branches, that is vertebral artery, thyrocervical trunk and internal thoracic artery. Now the thyrocervical trunk, again it gives 3 branches, that is the inferior thyroid artery, transverse cervical artery and suprascapular artery. From the second part of subclavian artery, 1 branch, that is the costocervical trunk, and from the third part of the subclavian artery, the dorsal scapular artery arises. Now one by one we'll see the origin, course and termination of the branches of the subclavian artery. Now first of all we'll see vertebral artery. The vertebral artery is one of the principal arteries which supplies the brain. In the diagram you can see origin, it arises from the upper aspect of the first part of the subclavian artery which ascends and goes into the foramen transversarium of upper 6 cervical vertebrae. Course, it emerges from the foramen transversarium of C1 and enters into the cranial cavity through foramen magnum. Now it terminates in the cranial cavity. It unites with the vertebral artery of the opposite side at the lower border of the pons to form the basilar artery. Internal thoracic artery, it is a branch of first part of subclavian artery. It is also called an internal mammary artery. Origin arises from. Now one by one we'll